Medications are very important in the transplant journey. It's probably one of the most important things in transplantation because it actually holds the whole transplant together. My name's Elaine Chan. I'm actually the kidney pharmacist. I see the patients through the whole journey, as well as that I basically make recommendations to make dosage adjustments because of the kidney function. But I also do a lot of education with the patients and talk to them and explain to them about what medications they use. If the person forgets to take medication or fail to take medication or change medications for whatever reason, there is a high risk that the body will actually find this organ and reject it. It's extremely important that the person takes the medication at the right time. There is some leeway, maybe half an hour and an hour on either side, but they do need to remember to take it. So we often ask people to actually put reminders in their phone now that technology is available to actually remind you to actually take your medications. Essentially, we do not want the body to ever find the organ, because the more likelihood of it being found, the more likely that it will reject. We start off with a little bit more anti-rejection drugs or immunosuppressants because at the beginning the body is very active. So if the transplanted organ is found at the beginning, that means you may risk rejection. Over a period of time, the amount of anti-rejection drugs will get decreased. So then it becomes a balancing game to actually prevent rejection. But then we also want to decrease the amount of medications used for rejection because it suppresses the immune system. So after the transplant, there is a risk that organs may actually have issues with clotting. So we use blood thinners to try to make sure that it actually gets a smooth run so that it's not as sticky. Some of the possible effects of blood thinning is that there is an increased chance of bleeding. And at any point after the transplant, if you know you're actually on blood thinning medication, you should actually check with the doctors to see if you need to stop for the procedure or the surgery. In terms of the amount of medications that a person will expect after a transplant, most people will actually be on what we call triple immunosuppression. So there will be 3 types of medications to suppress the immune system. And we would also use 3 types of antibiotics to prevent infection. So overall, it's about somewhere between 7 to 8 medications, because if you actually need a blood thinner, you may actually have an extra. So that's the basic core tablets. Having said that, not all of the tablets will have the same strengths or the right strengths for the dose that the person needs. So they may actually have to build up on the doses. There are times when it goes up to about 20 to 30 tablets. At the beginning, you'd get more, and then afterwards, it will actually slowly decrease. So immediately after transplant, the patient is actually brought back into the hospital quite often for blood tests. Up to the first month, it's likely that they will be changed every 2 or 3 days. On average, we will first dose the medications based on weight, and then we then do the blood levels to make sure they are actually within the right range, because too high levels will actually cause side effects and too little will actually mean that they risk rejection. I think it's very important to tell us any side effects or anything that you feel that you don't like or you feel uncomfortable, that you feel that I wasn't experiencing before the transplant. Tell us what it is, and it may be a side effect of the drug or it may be something else, but it's important because it could be a side effect, but it could also be an infection, or it could be something else that we might be able to address and fix. So I think it's very important that you communicate with the transplant team so we know exactly how you're feeling, but also that we can then address any problems and side effects for you. I think it is most important that the person knows their medications, how it's dosed, and when the dosages are changed so that they take the medications at the right time, and set your alarms so that you remember to take your medications.